Hi, my name is Dr. Tim Speciale. This is my good friend Jeff, and I wanted to talk about wrist pain. And we don't think about our wrist all the time. We use it all the time. There's many carpal bones in the wrist. And I remember as a kid, I sprained my wrist playing baseball. It took a couple of years to get better. And it's like anything else. A lot of us have weak ligaments and stretch, and that's what happened with Jeff here. And so Jeff, tell me what happened. You came to me 3 or 4 months ago, and what happened to your wrist? You're a carpenter by trade,
I'm a
and
carpenter,
you're left-handed.
Left-handed carpenter, right. And I experienced pain in my wrist probably for about 3 or 4 years. I'd missed 4 days of work at a time because the pain would be so bad. And a few months ago, I came to Dr. Speciale and got Prolotherapy in the wrist. And after 2 sessions, I went from 20% flexibility to, I'd say, 90%.
And how's your pain doing, Jeff?
The pain went from a scale of 1 to 10, and I was past a 10, and now I'm probably a 2.
And you were telling me about what you do. You're continuing to lift up drills and hammers and things like this from your
constant
your
motion.
belt.
Yep.
Okay.
Constant
So
motion.
continue repetitive motion.
Yes.
And so right now you're back. You've been working throughout the whole process.
Yep. Working hard, doing a bunch of work, and I've had no ill effects since the Prolotherapy.
Thanks, Jeff. You know, this is an amazing story. Here it is. There's 3 types of prolotherapy. There's dextrose prolotherapy, there's platelet-rich plasma prolotherapy, and there's stem cell prolotherapy. We do all 3 types of here. Now with Jeff, I examined him and I looked, and I was concerned because I thought we were going to have to up it to cellular prolotherapy, being the platelets or stem cells. But we said we'd do basic prolotherapy, and he had really stretched the ligaments of the scapula-lunate. Doesn't matter what they're called, but they were instability. And we did basic prolotherapy and prolozone. And I thought we might have to up it to platelet-rich plasma. He comes in today. He's much improved. And here's a gentleman that isn't resting yet. He's a carpenter. So 100,000 times a day, he's doing repetitive motion. Yeah, he's better. He's back to work. So this is an exciting thing. Most pain patterns that we do can be healed with prolotherapy, regenerative medicine. So thanks for joining us today, Jeff. Thanks for your input. You guys have a great day.